Dear friends, we all know that eyes are the gateway of our health and our mind. Do you know how many of you have really gone for a regular eye checkup? No, because we always take our eyes for granted. So today, I, Dr. Sunita Lulla Gur, Director and Consultant at AccuVision Eye Center, Sarita Vihar, thought of speaking on the topic that is importance of eye examination. Why this is important? Because if you see the figures, they are very alarming. There are so many millions of people who are blind because of eye problems, and many of these are preventable and treatable. In India, if you take the figures, 1 out of 3 blind people live in India, which is very alarming figure. So keeping this in mind, why not we talk today on why eye is important to be checked every year. Now the common causes of blindness in India, or visual impairment, I would say, I would not threaten that it's a blindness, but visual impairment, the common causes are cataract, glaucoma, retinal diseases, refractive errors. All these problems can lead to visual impairment, and if not treated on time can lead to blindness. Now coming to the regular eye health, whenever we go for a regular eye health, the eye doctor examines your eye. From there we can find out if you have any eye problem in any part of the eye. After that, we can also know that if you have any other disease which are affecting your eye health. So let's discuss about certain common eye disorders. For example, cataract. Now what is cataract? Cataract is the cloudiness of the lens. When we look at the normal lens, which is very clear, you can see over here in this eye model where this is the cornea, this is the lens, and this is the retina, and this is the optic nerve. So these are 4 structures where usually the eye problem occurs and can lead to visual impairment or blindness. One is cornea, lens, retina, macula, optic nerve. Now when we say cataract, this is the normal clear lens and this is the cataractous lenses. And if we don't treat on time, it becomes total cataract, which lead to blindness. So whenever you have blurry of vision, or you are finding difficulty in reading, or glare problem, or if you are not able to drive properly at night, then you might have cataract. So here a regular eye checkup is required, where you can consult your eye doctor, and if you find cataract, you can go for a surgery which is very easy to perform, and you can get your full vision back. The second cause is glaucoma. And what happens? This is the eyeball where the eye pressure increases and starts hampering this optic nerve. It compresses the optic nerve, which leads to blindness. So many of the times in glaucoma patients, the patient will never have any problem. That is why it is also called as silent eyesight killer, the thief of the eyesight. So early detection of glaucoma is must, because we can arrest the glaucoma changes to occur to prevent blindness, and if we can treat glaucoma on time, the glaucoma can be arrested. Then that is why whenever you go for a routine eye checkup, the doctor examines your eye, and if he finds any problem with your eye pressure or the optic nerve, then you are advised to go for glaucoma investigations. The third condition which can usually lead to diminution of vision as age-related macular degeneration. This happens in patients who are above 50 to 60 years of age. In India, we see age-related macular degeneration in about the age of 60 years. Now, why it happens, we really don't know, but it's a degenerative process where the macular part, that is the main area of the eye, gets affected. So if we see, this is the eye structure. So this is the macular area where this gets affected and leads to blurring of vision. Now again, whenever we diagnose it as a macular degeneration, then it can be halted. The process of macular degeneration can be halted, or it can be prevented for further loss by stopping that macular degeneration at that place or slowing down the process. One can have good nutrition, take care of your regular eyes, go for a proper checkup so that your doctor examines for it and let you know that if you are suffering from any of these problems. Again, in diabetes, as you know, it's now becoming, India is a hub of diabetes. So diabetic retinopathy is to detect any changes because of diabetes is called as diabetic retinopathy. So if we detect any occurrence of diabetic retinopathy, where what happens, these are the nerve vessels, these are the blood vessels in the retina, which become, there is a thickening of the blood vessels. So the blood flow gets hampered because of that and can lead to diabetic blockage of the vessels, and hemorrhage can happen in the retina, and there can be swelling in the retina, which can lead to blurry of vision or visual impairment. So whenever we ask you to go for a regular eye checkup, or if you have diabetes or hypertension, or if you have a family history of diabetes or glaucoma, then one should go for a regular eye checkup. So the action needed is, early is the eye checkup, preventive is the measure, and healthier are your eyes. So take care of your eyes. So friends, when should you get your eyes checked up? In babies, I would say within 1 month of birth, or 6 months, or the first birthday gift you can give them is a regular eye examination. We do so many parties and spend so much money on that, but the nutshell for your baby is because they are also our babies, our children are our eyes. So we have to take care of them by going for a regular eye checkup. So if earlier you do, the better. That is by the age of 6 months or 1 year. In children, refractive errors are very common, and these refractive errors, if not treated on time, can lead to visual impairment, lazy eye, and we have seen that children's performance, if they have refractive error, then the performance and the cognitive abilities of the children are very, very much reduced, and the performance in school is not good. So all children in preschool, before going to school, that is in preschool age only, they should get their eyes checked up, and if there is any refractive error, then once in a year, or whenever your doctor advises you to come for follow-up. In adults, I would suggest after the age of 40 years, everyone should go for an eye checkup, so that if you have any of the problems which I have discussed earlier, if detected early on time, can be treated and blindness can be prevented. Thank you.